Hello again, I'm Dr. Bryan Hulsey from Foundations Chiropractic and Functional Medicine in Corvallis, Oregon. Now today I wanted to talk about functional lab ranges. I know, woohoo, lab ranges. So what I want to look at is some of the reason why you're still having symptoms, but your MD or primary care physician has said everything is fine with lab work. So if you could think about our big a bell curve here. So a bell curve takes our whole population and now divides it into particular regions here. So what is happening, most lab ranges are set for the sickest people that you can think of here. So these people make up this part of our bell curve. So again, way out here, this is our clinical range. Many times, your primary care physician, your MD or whatnot, is looking at these ranges. So we have to be well beyond feeling crappy, and we actually have to have organ dysfunction before they'll actually do something and step in and give an intervention such as a medication here. So what I'm looking at is this area right in through here. This is our functional range. So whatever the lab test is, I want to be within that range. That's going to tell us, that all systems are functioning properly here for each individual lab marker. So we look at all of your blood tests in regards to functional range here. Now, the sad part of the story is many of you are going without help because you're having symptoms, and however your lab tests aren't outside of this clinical range here. So this is now where we have symptoms. We're outside of our functional range, but not quite our clinical range. So a good example of this is blood sugar. So blood sugar, our optimal range is going to be between 85 and 100. Over 100, we now start getting the idea of insulin resistance. Over 125 is now diabetes. That's where they start doing something about it. But there's a big gray area between 100 and 124 that people have symptoms. We can start seeing brain fog. Maybe I have to take a nap after I eat all the time. I have this crash in the afternoon where I feel like I need caffeine, or I have a starchy meal, my blood sugar levels crash a few hours later, I feel like I need something sugary to bring that back up. So that's a great example of that. Another one is thyroid stimulating hormone. Our standard range on that is 0.5 to 5.5 there, where our functional range is 1.8 to 3 there. So a lot of lab ranges are just way too broad to pick up the kind of dysfunction in systems that may happen that give you symptoms there. So again, just a brief outline of why we're doing things differently. There, we want to pick up some of these things before we have tissue destruction, organ destruction, or too much organ destruction that now we need a medication to help with that. So we're looking at things in the functional range. There's a lot that can be done to help bring us back into our optimal range there. I'm Dr. Bryan Hulsey at Foundations Chiropractic and Functional Medicine. I hope this video finds you well, and please look forward to more videos here in the future. I look forward to helping you reinvent your life.